All right, guys, this is week 3, part 1, safety and compliance. The first, you need to know these agencies and what they do, and kind of have an idea of how they would relate to you in phlebotomy, okay? So, the Joint Commission is a voluntary, non government agency. It's the oldest and largest healthcare standard setting body in the nation and focuses on improving safety for patients and residents, okay? So the big thing you need to know about the Joint Commission is the Sentinel Event Policy. This helps they help organizations identify safety issues and prevent them. A sentinel event is when a death has occurred, something like the wrong surgery happened on the wrong patient, those kind of things. And what they're going to do is first come in and do a root cause analysis, find out why this happened. So, was the patient being asked what their surgery was for and identified at every step in the process? Those kind of things. They're going to develop an appropriate action plan, implement improvements to reduce risk, and then monitor the results of those implementations. The National Patient Safety Goals are part of overall quality indicator requirements. It's overseen by a safety panel of physicians, nurses, risk managers, and other healthcare professionals. So, for example, the patient safety goals for 2015 were improve the accuracy of patient identification, improve the effectiveness of communication among caregivers, and reduce the risk of healthcare associated infections. So these national patient safety goals go out every year to facilities across the nation, and then those facilities let their healthcare workers know, and then everybody works together on these goals. Specimen collection is a part of CLIA inspections. CLIA is the Clinical Lab Improvement Amendments Act of 1988. So what they do is establish quality standards that apply to all labs. It classifies the standards based on complexity of testing, okay? So this is where I talk about CLIA waived testing, like pregnancy tests, strep testing, those types of tests that come in kits that say a reasonable person, it is within their scope of practice if they have been trained on these procedures that they can do them, basically, and report out the results. Okay? CLESI is the Clinical Lab Standards Institute. Its mission is to develop and promote best practices in clinical and lab testing. They develop voluntary guidelines and standards for all areas of the lab. So this is a voluntary agency, but they are the ones that say that your pants should not be more than, or should not touch the ground. They should be an inch and a half off the ground. That is CLESI, okay? The National Accrediting Agency for Clinical Lab Sciences, which phlebotomy falls under, we nickname it NACLS. They are the authority on educational quality, so they're the one that gives accreditation and approval of educational programs, okay? Their purpose is to, what they do is they come in and make sure that all the standards are the same across the board, so that anyone graduating from a school accredited, nationally accredited, will be turning out the same caliber of students, basically. Okay? You do need to know quality assurance. Quality assurance is a program or process designed to prevent problems in the future. It helps ensure quality patient care. QA indicators. These are guides to monitor all aspects of patient care. So, a quality assurance indicator, you need to know it must be measurable, well-defined, objective, specific, and clearly related to an important aspect of care. What does that mean? So that means that we set a guideline to let us know if we're doing our job well or not, if we're giving quality patient care, okay? So measurable, we could say one of our QA indicators are going to be the number of misidentified patients. That's measurable. We can count that, right? It's well defined. There's no gray area. Did they identify the patient correctly, or did they misidentify the patient? Objective. That is a standard of care. It's due care. There is no agenda behind this QA indicator. It is the best for all, okay? Specific. We know the parameters and what happens if those patients are misidentified, and clearly related to an important aspect of care. It's clearly related to life and death of patients, okay? That would be a QA indicator. That is saying that if misidentification falls outside of this threshold, outside of these indicators, then we need more training. We need to regroup and find out what the issue is, okay? A threshold value is a level of acceptable practice beyond which quality patient care cannot be assured. It must be established for all quality indicators. Exceeding the threshold value should trigger an evaluation, and a corrective action plan may be established. And for example, only one patient misidentification acceptable this month. Okay? Quality control is different than quality assurance, okay? It is part of a quality assurance program. It is a form of procedural control. It identifies weaknesses in the processes at the practice level which cause poor patient service and errors in the lab. So our quality control in phlebotomy would be making sure we're not using expired tubes. Quality control in testing would be using the liquid high and low controls to make sure that the machine is reporting out results accurately. All right, so listed on here are areas subject to quality assurance, okay? So was the procedure explained to the patient? Did they need to fast? Do they know they'll be in the lab for 3 hours? Do they know that this test needs to be scheduled? Okay. Those are all things that should be explained to the patient, because when they show up and don't know these things, it affects the testing and affects how the rest of the day is going to go and how the rest of the visit is going to go for that patient. Okay. Patient identification, the equipment we've talked about, doing the correct technique and making sure we are collecting in the right collection priorities. We have ASAP, which is as soon as possible. STAT needs to be done immediately. Routine, we say, should be done within 4 hours. And then time, there are some tests that have to be collected on time. Some have a 30-minute window, some have only a 5-minute window, okay? These will all affect the quality of patient care we are giving. The patient record, it is a legal document. It is a chronological documentation of medical care given, required by law for hospital patients. Every notation should be legible, precise, and complete. Its purpose is to aid in the practice of medicine, aid in communication, and may be used in court. It helps the hospital evaluate performance outcomes as well. All right, online test catalogs. We have reference manuals. These give us detailed instructions on how to prepare our patient and special collection needs, okay? It will tell you the type and minimum amount of specimen needed. It will give you the special handling requirements, reference values, the day the testing is available, and normal turnaround time. So if you do not know, if the doctor calls you and down to the outpatient lab or wherever doctor you work for says, hey, I need this test done, you have online test catalogs, if you're contracted with LabCorp, Quest, wherever you're contracted, that you can go look up that test and it will tell you. So if they only run the test on Monday, Wednesdays, and Fridays, and the test needs to be incubated for 24 hours before it's sent out, and it takes 2 days to get there, you need to keep all of that in mind as you schedule that patient. You may not be able to draw it that day, okay? And you may need to go back and tell the doctor, like, we can't do it today. Is there a different test? You know, we have to be proactive, and understand what we're there doing for the patient, okay? We're there to help them, and so we're not just going to say, oh, it can't be done, and that's the end. Let's give them some options. Let's talk to the doctor. Let's figure out what we can do. This schedule them and let the patient know. That's explaining all of this to the patient so they understand why they can't just get it done while they're here, okay? A lab procedure manual is going to tell you the policies and procedures for each test and practice and must be available to all lab employees, including phlebotomists. So this is where you're going to see your facilities policy on these different procedures and things that I'm teaching you here in class, okay? A safety manual contains procedures related to chemical, electrical, fire, and radiation safety, exposure control, disaster plans, and handling hazardous materials. This is part of your scope of practice and your job description to understand where that information is, where you can find it, and how to handle situations that would require needing that manual, okay? Infection prevention and control, we've talked about that a lot already. Quality assurance forms, they're equipment check forms. We have incident reports. You need to know for an incident report, you need to identify the problem, state a consequence, describe the correction. These forms, incident reports, should always state facts, not feelings. This is an example of a incident report. You need to be able to look at these documents and answer questions based on reading the document. That is where your critical thinking is going to come into play. So you may have a question on your certification in a sample document like this. It's not the QA form that's going to come up in a few more slides. And it may say, what was the primary issue, or where would I find whatever, and you're going to have to look on that form and find the information, okay? All right, legal issues. How do we avoid lawsuits? We always get acquired informed consent before collecting any specimen. We respect a patient's right to confidentiality. We strictly adhere to accepted procedures and practices. This is where I tell you, like, yeah, you could probably draw right there, right at the wrist, right in that inch that your wrist starts, but it's not a good idea. It's not a good idea to hit an artery. You know, you have to use best practices, and that's what I'm teaching you, okay? But I say that because you're going to go out in the real world and you're going to see a lot of different things, and you're going to have to choose, is this a risk that I'm willing to take? Okay? You can always get help. You can always get someone else to help you draw, okay? We're going to use proper safety containers and devices. We're going to listen and respond appropriately to patient concerns and comments, okay? We're going to accurately and legibly record all patient info, document incidents and occurrences, participate in continuing education to maintain proficiency, and perform at a prevailing standard. Now, all of this, I tell you, because if you always operate within these parameters, and you maybe get called into court, and you can sit here and list, like, by the book how you're supposed to do something and know that you follow that procedure every time. If you can show your continuing education, your safety trainings, you can take all of that with you and show, like, you are dedicated to your job, you know what you're doing, and you're going to be able to prove that you did things the right way, okay? So informed consent is voluntary competent permission. It requires all the information is given to the patient in non-technical terms and obtained before the procedure, okay? Hey, your doctor ordered some labs. I need to draw your blood today. Is that okay? Very simple, okay? You would also say, you know, it's going to be a quick stick in your arm or a quick finger stick. You can add that in there as well, okay? Implied consent. That is when the patient's actions imply consent. It may be necessary in emergencies, and the laws vary from state to state. If the patient puts their arm out, they're implying consent. If someone shows up at the ER but passes out in the waiting room, we're going to do everything because they implied by showing up to the ER that they wanted help, okay? HIV consent. Most states have legislation regarding the consent for HIV test. The client must be advised on test and its purpose, how the test will be used, the meaning of its test, and its limitations. We do not want to send people into panic, okay? So typically, and I know for Kentucky, they have a separate HIV consent form that explains all of this for a patient, and they would sign it, okay? Consent for minors. Minors cannot give consent for medical treatment. A parent or guardian consent is required. Personnel who violate this rule are liable for assault and battery, okay? Refusal of consent. A patient has a constitutional right to refuse any medical procedure. Refusal may be based on many different factors, religious or personal, and sometimes a refusal must be documented in writing. So, for you all, if a patient refuses a venipuncture, getting their blood drawn, or any special collections you may have to do, okay? They refuse this medical procedure you're trying to do. You need to let their doctor, their doctor's nurse, the medical assistant, someone in that chain that sent them to you needs to know. And then you need to document in their electronic medical record where you are accessioning the test, where you're putting them in the computer, that kind of stuff. You're going to note that, and you're going to note who you spoke with, what time, the date, your initials, and what was said. You're going to document that, okay? Very, very important, because those nurses, MAs will forget to tell the doctor, and the doctor's mad that you don't have these results. And if you didn't put it in the computer that you did your job at the time you were supposed to do your job, you're going to be cussed out by a doctor, and that's not fun. I really don't like it. I really, really don't like it. And I'm sure you're not going to like it either. So making sure that you are covering your behind, okay, is what I'm getting at here. Okay? That is all for this part. I'll see you on the next part.